Hi everyone, welcome back. I am Dr. Sandeep Vaidya, Pediatric Orthopedic Surgeon at Pinnacle Ortho Centre Hospital, Thane. Today I am going to talk about a condition which is a bit rare, but nevertheless parents of newborn babies should be aware of this condition. So I am going to talk about a condition called Developmental Dysplasia of the hip, also called DDH. Sounds a bit scary, but the good news is that if we find it early, it is usually very simple to treat. So what exactly is DDH? So imagine that your baby's hip joint is like a ball which rotates in a socket. So in a healthy hip joint, the ball sits perfectly inside the socket. However, hip dysplasia is a condition where the fit isn't quite right. The cup may be a bit too shallow or the joint may be too loose, which allows the ball to slip out of place. So basically, it is an unstable hip. Now, which babies are more at risk? So there are a few common factors which we should look for. Number one, it is more common in firstborn babies. Number two, it is more common in baby girls. Babies who were born in breech position, that is with the feet first in the womb, are also prone to get DDH. Also, if there is a positive family history for DDH, remember that it can happen again. But remember that it can happen to any baby in which none of the above risk factors are present. So as a parent, what are the red flags which you should look out for? First, look at the skin folds on your baby's thighs. Are they uneven? If it is so, it could be DDH. Secondly, does one leg appear shorter than the other? Third red flag, you might notice that one hip is less flexible than the other during a diaper change. And for older babies who have just started walking, you might notice a limp or a waddling type of walk. So if you see any of these signs, don't panic, but do consult your doctor for a checkup. Next point, can parents do anything to decrease the chances of their baby getting DDH? So here it is important how you swaddle your baby. Never wrap your baby's legs tightly straight. Instead, always make sure their legs have plenty of room to bend up and out in a natural frog position. This is called hip safe swaddling and it helps the hips to develop correctly. This brings me to the most important point. Early diagnosis is everything. Why do I say so? Because the treatment is much simpler in the first few months of life. For a newborn up to 6 months of age, we often use a simple soft brace called the Pavlik harness. It is not at all painful. It holds the baby's hips in the correct frog leg position, allowing the joint to develop normally on its own. If diagnosed later, between the ages of 6 months to 2 years, we might need to put the hip back in under anesthesia and use a special cast which is called the hip Spica cast. And this Spica cast needs to be applied for a period of about 3 months. However, in older children, generally after the child starts walking, the treatment can become more complex and may even require a surgery. So you can see why finding this condition early makes a huge difference. So the takeaway is simple. Be aware of the signs of DDH and if you have any doubt, however small, get it cleared. Don't wait. Here at Pinnacle Ortho Centre Hospital, we are dedicated to ensuring your child grows up with strong, healthy bones. Your peace of mind and your child's healthy future are our top priorities. Thank you.